Okay, so when you think of a pharmacist, what's the first image that pops into your head? Probably someone behind a counter, right? Counting pills, putting them in a bottle. Well, what if I told you that in Alberta, that picture is being completely redrawn? We're talking about a genuine healthcare revolution here, a total reimagining of what a pharmacist is and what they can do.
So, let's really get into what this change looks like. I mean, this slide says it all. On the left, you've got the pharmacist we all know, dispensing prescriptions, giving some advice. But look at the right. That's the new reality in Alberta. We're talking about assessing patients, actually diagnosing conditions, prescribing medication, and even managing long-term chronic diseases. They're essentially becoming primary care providers. It's a whole new ballgame.
And this isn't just some idea being floated around. Nope. This is happening right now. Pharmacists are literally moving out from behind the counter and onto the front lines, even opening their own walk-in clinics.
That's right. Over 60 of these pharmacist-led clinics are already up and running across the province, and people are walking in, expecting and deserving the same level of safe, high-quality care they'd get from any doctor's office.
But here's the catch, and it's a big one. What happens when this kind of amazing innovation moves way faster than the rules and regulations? Well, this huge leap forward has uncovered a pretty serious risk. We've got a system that's kind of, well, flying without a safety net.
This line, and it comes from pharmacists who are actually doing this work, just captures the situation perfectly. Building the plane while flying it. You can just feel the excitement and ambition in that, right? But you can also feel the danger of trying to figure things out midair when you don't have a plan.
And look, this isn't just a vague feeling of risk. We're talking about very real gaps. There are no standardized treatment plans, no consistent way of keeping records, and a huge question mark around legal responsibility if something goes wrong. So what does that mean for you as a patient? It could mean you get totally different advice for the same health issue at 2 different clinics. These aren't just minor details. This stuff is the absolute bedrock of patient safety.
To really understand what this feels like on the ground, let's take a look at the story of a pharmacist who was one of the very first people to jump into this new world. This is Ahmed Abdul Fattah. He's one of the pioneers who opened one of the first independent pharmacist walk-in clinics in Alberta, and his words are pretty stark. He says he had to build everything from scratch. Just try to imagine that for a second. No guidelines, no templates, no roadmap to follow. He was on his own. And this right here really gets to the core of the problem. A modern healthcare system just can't rely on the heroics of one person figuring it out. It has to be safe, consistent, and reliable for every single person, every single time. So what's the fix? Well, it's pretty simple in concept. It's all about building the guardrails that are missing right now. So when we use this term framework, what are we actually talking about? Think of it like a playbook. It's a clear set of rules, guidelines, and standards that make sure every single patient gets the same high-quality care no matter which clinic they happen to walk into. The proposed solution really boils down to 3 key things. First, create one standardized framework for all of these clinics. Second, get really specific and develop clear guidelines for treatments and paperwork. And third, establish clear legal protections for pharmacists. It's a direct, common-sense answer to all the problems we've been discussing.
This quote just perfectly nails the whole issue. The permission, the legal ability for pharmacists to do this new job, that's the scope, it's already there. But now, it's time to build the support system that actually makes it work safely and effectively for everybody.
So why does any of this really matter to you? Well, at the end of the day, it's all about the safety and quality of the healthcare you and your family receive.
Remember that number we talked about? Over 60 clinics are already open, and that number is just going to keep climbing. This isn't some distant future problem. This is about making sure that the thousands of patients getting care right now are safe. Honestly, what's happening in Alberta is a fascinating sneak peek into the future of healthcare everywhere, and it leaves us with a really big critical question. As we keep pushing the boundaries and innovating, how do we make absolutely sure that safety keeps up with the pace of change? The answer to that is going to define healthcare for all of us for a long, long time.